The California Hospital Association is the professional trade organization that represents and advocates on behalf of all 400 California hospitals. All the hospitals are members of CHA, and its purpose is to represent them in Sacramento, in the executive, legislative, and judicial branches of government, as well as at the federal level in cooperation with the American Hospital Association and other national organizations. It is the vision, the policy vision of CHA that we have an optimally healthy society. And our goal to achieve the vision is that every Californian should have equitable access to affordable, high-quality, medically necessary health care. And in California, implementing the Affordable Care Act is number one, along with equitable access of the public to health care services, making them affordable, changing the delivery and financing systems to become more effective, eliminating duplication, fragmentation, and creating alignment across the board, beginning with physicians and hospitals and spreading to other healthcare providers, and then the payers, purchasers, and government. The Medicaid program is the worst in the country. On a per capita basis, payments to healthcare providers in California is the lowest in the nation. However, we're the fifth highest cost of living state in the country. Therefore, there's a big gap between what is paid for Medi-Cal patients in California versus what the cost is. And more than half of California hospitals operate in the red. And it's almost impossible to fundamentally change the way you do things when you are losing money just trying to stay in business to provide services. You can't jump out and become an influencer overnight in the broad arena of healthcare delivery, financing, or reform. Being an effective team member and leader within the organization has to be step number one. Take that foundation, stand out, and do it in such a way that you are collaborative, cooperative, inquisitive, and a contributor. The best way to gain experience is to live it. The best way to live it is to be an exploring, inquisitive person that studies, works hard, and keeps an open mind. So hard work, the right attitude, collaborative personality gets you there. But we always have to remember one thing. Regardless of what we want to do professionally and of our aspirations, the patients and maintaining health of people must be number one. Well, I think formal education is necessary, and a master's degree is desirable if a person can go to a school of healthcare administration or public health or their health sciences. There are a number of programs in California and around the country. And I believe that it's important if a student can do so to complete at least that phase of formal education. And then either get into a residency or into a position that fits with their professional goals. Many times people start out in one area and end up in a different area. Right. Sometimes in a completely different profession. But in healthcare, you don't know exactly where you may end up because of the way in which careers develop. But after formal education, after some initial exposure, if that's possible, obtaining a position with an organization that is at least directed in the general area of your interest. Right now, at the federal level, for every dollar we spend, we're borrowing 40 cents. We have over $16 trillion in debt, and we're adding 10% a year to that amount. Not sustainable. Social Security is $22 trillion underfunded. The Medicare Hospital Trust Fund is broke in 2024. So if you look at all of these factors, you say, we're falling off the cliff. Mm-hmm. If we continue like we are, we will. So what that says is we have the greatest opportunity in our entire lives to redirect healthcare in a fundamental way. Make basic changes that will get us to a new level of healthcare. In California, the state has a $16 billion deficit. We're trying to wrestle with it with half new revenues and half expenditure cuts. As I said, Medi-Cal is the worst paying Medicaid program in the entire nation. And with the large number of undocumented residents that we have, as well as the uninsured, it doesn't look good. The cost shift in California to the private sector exceeds 30%. We'd step back and say, all is lost here. Mm-hmm. Not true at all. If we recreate the financing, payment, and delivery systems and bring ourselves together in a coordinated, collaborative, integrated manner with aligned incentives, we will actually move from sick care to population health. We will move from isolated, fragmented care on an episodic basis to total coordinated care across the entire continuum of life. Mm-hmm. By doing that, we will save money. We will improve the quality of care. We will improve life, not only for ourselves, but for the public.